So with that announcement that we're being recorded and given that it's almost 12:05, I think we'll get started. Welcome to the University of California Center Sacramento weekly speaker series, where we're very pleased to bring you this special event on the role of the public university during the COVID-19 pandemic. To help us engage in this discussion, we have two distinguished luminaries who I will introduce presently. But first, a few words of introduction. Since the COVID-19 pandemic arrived in our state in late February, the University of California has played a leading role in the direct provision of healthcare. It's contributed to breakthroughs in our understanding of the biology and epidemiology of the coronavirus, and has organized significant public health and public education efforts aimed at combating the virus and reducing health disparities. However, at the same time, due to rapidly changing circumstances, the university has struggled with issues such as how to maintain equity while delivering instruction remotely, and when and how to reopen its campuses for teaching, research, and college life. And like other institutions of higher learning, UC is undergoing profound fiscal shocks resulting from sharply diminished revenues from multiple sources. So again, here to unravel some of the lessons of the past 7 months are our two distinguished guests. So Gary May is Chancellor of UC Davis. He came to UC Davis in 2017 after serving as Dean of Georgia Tech's College of Engineering. He earned his master's and PhD degrees in electrical engineering and computer science at UC Berkeley, subsequently winning many awards for his research in computer-aided manufacturing of integrated circuits. He's been honored with the Presidential Award for Excellence in STEM Mentoring and is a member of the National Academy of Engineering, as well as the American Academy of Arts and Sciences. And this is a bit of editorializing, but in less than 3 years, Chancellor May has ushered in what I regard as a new spirit of openness and innovation on the Davis campus. One example being his flagship project, Aggie Square, which is designed to join the university and the city of Sacramento in a new spirit of entrepreneurship and collaboration. Dr. David Lubarsky is Vice Chancellor of Human Health Sciences and Chief Executive Officer for UC Davis Health. Since joining UC Davis Health in 2018, Dr. Lubarsky has established important ties with local governments, entrepreneurs, and other health systems to address health disparities and health workforce needs. He has a bachelor's degree in history, no less, from Washington University, St. Louis, where he also earned his MD degree. In addition to his vice chancellor duties, Dr. Lubarsky serves as professor of anesthesiology and nursing and is a faculty member in the UC Davis Graduate School of Management. Like Chancellor May, Dr. Lubarsky has created conditions for clinical and academic excellence. In addition, he's taken on the very tough and surely unanticipated work of steering the UC Davis health system through the first 7 months of the coronavirus pandemic. So today's session is a little different for us. It's designed as a kind of conversation, and you, our audience, are part of it. First, Chancellor May and then Dr. Lubarsky will each talk for about 10 to 15 minutes. Then I will follow up with some questions to further probe their thinking on the role of public universities during these altered times. And then we'll open up the floor to questions from you, our audience. So to ask a question at that point, please raise your hand using the Zoom feature, and a member of our staff will call on you. So now, without further ado, Chancellor May.
Thank you so much, Richard. Good afternoon, everyone. It's a pleasure to be here representing UC Davis. I want to thank Dr. Kravitz for inviting Dr. Lubarsky and I to take part in today's discussion about higher education's role during this pandemic. As we all know, this has been a year like no other. The COVID-19 pandemic has turned our world upside down. In addition to the health risks and healthcare disparities, many are suffering from job losses and other socioeconomic impact. If that weren't enough, we've had to contend with yet another year of devastating wildfires and unhealthy air quality, and the sustained social unrest in cities across the country as well. So now more than ever, we see the value of having a leading public research university with a world-class medical center right here in our region. And I'm proud of the leadership and innovation that UC Davis has shown during this public health crisis. We're advancing the UC Davis public mission in many critical ways, and I want to applaud Dr. Lebarski for his leadership during these trying times. First and foremost, we owe a tremendous amount of gratitude to healthcare workers at UC Davis and beyond. Their commitment to patient care and public health in the time of a pandemic is nothing short of heroic. UC Davis Health actually made national headlines in February after treating the first case of COVID-19 acquired from community spread. And that patient was treated at the UC Davis Medical Center. In those early days, UC Davis Health was instrumental in prompting the CDC to actually change its testing protocols and published an index study on that first patient. Since then, UC Davis Health has several clinical trials underway, and I'm sure Dr. Lebarski can tell us more about those. All across UC Davis, researchers from a wide variety of disciplines have joined together to pursue COVID-19 solutions. Our schools of medicine, veterinary medicine, and the Center for Immunology and Infectious Diseases are all collaborating on vaccines, clinical trials, and diagnostic testing. Our College of Engineering teamed up with the School of Medicine, and their researchers produced ventilators and 3D printed test swabs. We have communications experts analyzing millions of social media posts to identify emerging outbreaks and how they move. This is just a few examples of how UC Davis is driven to be a part of the COVID-19 solution. In the meantime, the campus was rising to the challenge of suspended operations and public safety measures. In March, our faculty, staff, and students made the abrupt transition to remote working, instruction, learning, and virtual events. For fall quarter, the vast majority of our courses will be taught remotely. Only about 35 courses will be conducted in person with social distancing and other safety measures in place. And many of these we're using tents to serve as outdoor classrooms. Of course, the safety of our community will continue to be our top priority. In these unprecedented times, higher education can and should be a part of the solution. We have a shared global responsibility in higher education to fulfill our missions. This is the time for higher education to continue advancing creative solutions that will ensure our communities are stronger and our planet is safer. So at Davis, we have the tripartite mission of research, teaching, and public service. And all of those are critical now as we conduct groundbreaking research to combat this pandemic and other global challenges. We continue to provide world-class learning for our students, largely remotely, to ensure their safety and well-being. And we serve our communities through scholarship that is publicly engaged in fields from engineering and law to social science, humanities, and throughout our UC Davis health system. Higher education can also play a crucial role in mitigating some of the inequities that are exacerbated during these times in this pandemic. Academic leaders are in a unique position to address both healthcare and disparities and social equity issues. We do that by providing access, opportunity, and advancement for everyone. When it comes to the global pandemic and social justice, our institutions have the expertise and the motivation to be a true force for good. This pandemic has exposed not only our society's gaps in care, but also the deeply embedded social, cultural, and economic inequalities that lead to higher mortality in Black and Latinx communities. According to one UCLA study, Black and Latino residents of Los Angeles County were twice as likely to die of COVID-19 than whites. Further, the county data showed that COVID-19 mortality rate in its poorest communities was quadruple that of its wealthiest communities. When looking only at working age Californians, the disparities are even greater. While Latinos make up 39% of California's population, they account for about 57% of COVID-19 cases and 46% of deaths. Among residents ages 18 to 64, Latinos account for 68% of the deaths. We're seeing these types of health disparities across the nation. So the pandemic presents a highly teachable moment. This is especially true in medicine and healthcare. Students are learning about the manifestation of diseases and how they take shape in different parts of the world. They're also learning about healthcare disparities, social determinants of disease, and how to address these challenges. Our students are seeing firsthand how interconnected our world truly is. Fundamentally, they're learning about being a part of a global community and how global problems like climate change, as well as pandemics, have local consequences. Conversely, they're seeing that local problems like diseases with pandemic potential can quickly become global problems with widespread repercussions. COVID-19 doesn't respect borders, and we know it's not going away anytime soon. We must prepare our students to tackle the world's greatest problems by helping them understand global challenges and inequalities and become change makers. No matter what 2020 throws at us, our campus community is quick to show support. When the wildfires started to burn, our UC Davis Fire Department was quick to help. By late August, they'd logged hundreds of hours fighting fires around the state. The UC Davis Medical Center played its role as well, treating people in the intensive care unit for burns suffered during the fires. And he managed this while keeping up with the pandemic. The School of Veterinary Medicine was right here also, often heading to areas most impacted by the fires. They treated more than 1,000 animals so far, including cats, horses, cattle, all that needed help with burns and other injuries. The fires directly impacted members of our campus community. UC Davis provided emergency housing for 45 people from 15 households who evacuated or lost their homes. This included 5 staff members, 8 students, and 2 faculty. They came with 19 animals, including service and emotional support dogs. Sadly, one of those households lost their home to the fires. Of course, there's another way that universities like UC Davis can have a positive impact during the pandemic, and that's continuing to support the economic health of our region. COVID-19 clearly had a devastating effect on the nation's economy. In California alone, more than 2.6 million jobs were lost in March and April. Faculty members at our Graduate School of Management are studying this impact very closely. They're looking at how long a full recovery might take and what steps are needed to bring the economy back to normal. So far, UC Davis has largely been able to avoid layoffs and furloughs. We've done this by implementing salary freezes, holding positions open should we need them for internal candidates, and redirecting staff to areas of the campus in need of support. But to be clear, we felt the economic impact as well. Between March and June, the end of June, end of our fiscal year, we experienced unanticipated expenditures and revenue losses of over $181 million. Now, UC Davis received $34 million as part of the federal government's $2 trillion CARES Act. And about half of that provided direct financial support to students for increased needs related to the coronavirus. And this level of funding is helpful, but clearly doesn't meet all of our needs. On the subject of our regional economy, though, I am happy to say that we are moving forward with Aggie Square, as Dr. Kravitz mentioned in my introduction. That's the innovation ecosystem that we're building on our Sacramento campus. And the city of Sacramento is a very strong collaborative partner in this effort. Our recent economic impact report predicts Aggie Square will add nearly $5 billion to the Sacramento region's economy each year and support 25,000 ongoing jobs. We have an opportunity to drive entrepreneurship and innovation as our faculty and researchers work side by side with private companies in this initiative. We've completed designs for the first phase of development that will include 2 science and technology buildings and a lifelong learning and classroom office tower. And we've already announced collaborations with IBM and food icon Alice Waters. Our development partner, Wexford Science and Technology, is working to line up additional industry partners for us. I'm looking forward to more exciting developments in the months to come. Let me wrap up by saying that I remain optimistic. UC Davis is determined to serve the public good and be a beneficial community partner. Our faculty, staff, and students are an integral part of the greater Sacramento region, so we're personally invested in both the health and economic well-being of Davis, Sacramento, and beyond. One key thing I've learned during this turbulent year is this: in times of great challenge, UC Davis never fails to show its strength. Our role as an institution could not be more profound as we address not only the crises of today, but provide the research and expertise to prevent others in the future. But we can't do this alone. In times of crisis, collaboration is more important than ever. So that includes working with government, business, community organizations, and community members. We are truly all in this together, and our well-being relies on this interdependence. Looking forward to a great discussion today. Thank you for listening.
So thank you, Chancellor May. Let's go right over to Dr. Lebarski.
Thank you, Richard, for inviting me. And I think you heard what Chancellor May had to say, which is that, we really are a public university, and that under his leadership really committed to equity and advancing equity in our society. And that extends obviously to the healthcare mission. When I talk about what has happened through the COVID crisis here on the Sacramento campus of UC Davis, it's really clear that the faculty, the staff, and the community have really risen to the challenge. I would say that the role of the public university during this time has, revolves around research, obviously, education, but education in a broader sense than just students, because contributing our thought leadership to the issues of importance to the state government and those making rules, regulations, and trying to figure out how to respond as a society, as well as continuing education of the public by using our expertise, which has been hard won, I might add, with each day changing information around COVID, and trying to really use the intellectual power of our academic faculty to sort through the sometimes conflicting data that comes along, and sharing that with our community, with our legislators, and with our families even, right, who are confused by the differing accounts of what's happening in the world that we see on TV. And last but not least, this epidemic has uncovered a true divide in health outcomes. It's not only access, it's not only specific communities around COVID-19. It really is the failure of our healthcare system to create equity for all in our society in terms of having a reasonable chance of a healthy life. And COVID-19 has just really shown a spotlight on that. One of the first things about a public university is that it doesn't focus on self-interest, but on the public interest. And under Gary's leadership, I just can only stress that our ability here in Sacramento to take care of patients was tremendously augmented at the beginning, because all of the researchers and on the main campus, not thinking about themselves, but thinking about their role as a support in the public university, reached into their research supplies in order to help us over the chasm, if you will, of a lack of personal protective equipment for our personnel. And they not only did they donate it, but they went far and beyond in finding everything that they could possibly do to support us, which included the engineering school doing 3D printing when we ran out of some critical supplies, and in general also serving as teammates as we pursued research into the treatments and potential cures and vaccines for COVID-19. So an amazing aggregate effort of the entire public university, not just the health arm of the public university, in treating COVID-19 and contributing to the betterment of our care paradigms. So I think that's, of course, that's always number one, but the thought leadership is also really critical. Our personnel have been on the TV, they have been in the newspapers, they have been on panels with NIH and coronavirus task force leadership. They have informed CDPH and CHHS and CMA and CHA in ongoing discussions, and we have taken our role as a public university very seriously. We are not only UC Davis, but UC writ large has contributed tremendously to the discussion about what's the best way forward during this crisis. Under Carrie Byington's leadership, our new exec VP for UC Health, every single UC has contributed their best individual to a, well, if you will, a group of 5 or 6 or 7 campuses getting together, whether it's an infectious disease or public health. We have now a bioethicist group that is working on what happens during a emergency use authorization of a vaccine that may or may not have been completely vetted, and how do we offer that to our patients and with what caveats, and having the power of a public university really as a counterbalance to politically motivated decisions is an incredibly important role of the public university. Because again, we have our self-interest is the public interest. And I think that's a really important role for us to continue to play. And as a matter of fact, also, you know, in providing ideas around what happens if we have a negative 70-degree transporting vaccine, that how do you distribute that without including the public universities and their negative 70-degree freezers? I don't know. So again, really not only providing thought leadership, but actually true execution leadership in dealing with this pandemic. In terms of education, this has been an interesting journey. Our first-year medical students are 100% virtual. The idea of being a doctor and touching no patients, and the only thing they do in person is a little bit of anatomy, because you really can't do that all virtually, has been a journey, no different than the journey on the main campus, in terms of trying to figure out not only how do we involve people in their education, but create the community that is part of the structure that allows medical students to succeed and thrive in a very difficult course of study. And so that's been an education for us, and we continue to evolve, but it seems to be going well from what we can tell. But again, our role is actually to continue to, as we get successes, to publish on them and talk about them with our colleagues across the nation. I want to touch for a little bit on equity, because again, we have become, in essence, an extension of the public health arm of the County of Sacramento, and to a certain degree, the Yolo County as well, where our main campus is. As a matter of fact, one of our physicians just recently became the Chief Public Health Officer in Yolo County, Dr. May. And we have an amazing partnership with Dr. Balinson, who is the head of healthcare services for Sacramento County, and have really worked tremendously with a tremendous amount of contribution to increase access to coronavirus testing in a variety of community clinics, student-run free clinics, federally qualified health centers serving a variety of underserved communities, and also as one of the few places that could organize and test an entire nursing home on a single day and get all of the results in, so that we could, every time there's the suggestion that there could be a mini epidemic going on in a congregate living facility, stepping up to not only do the testing, but actually supply the nurses and the swabs and everything else to actually make this happen, because the public health has been tremendously underfunded in our country, in our state, in our county. We are quickly realizing this, and the role of a public university, although not previously necessarily allied with the public health per se, we, in this pandemic rather, we have really stepped it up. And it's not only UC Davis Health, but for instance, UCSF, working with their biohub there, have become the testing core for 9 counties around them. So the public health has really been tremendously well served by UC and UC's capabilities and their ability, without regard to their to their own financial status. We've all taken hits from the coronavirus limitation on care that occurred earlier, to do better. I'll just close by saying that we have refocused ourselves not only on patient care, which we've always done, but on really understanding the communities from which people arrive to receive care, because it's a very different world when someone has a potentially contagious disease and you say, well, you should just go shelter in place at home, and you realize they live in a multi-generational home and they don't have a bedroom all to themselves. It's a very different situation than someone who lives, with 2 people in a big house. And it's very easy for someone like Andrew Cuomo, Chris Cuomo, you saw him broadcasting from CNN from his basement where he was able to sequester himself. And so we really need to understand the cultural issues around not only the way that people approach this disease and some of the fear that people brought to testing because they were worried about the public charge issue and other political issues around immigration, and the ideas that the social determinants of health and where people live and how they live really impact the communication of COVID-19. So understanding all of that has been a journey for us. We think that we're ready for the next 6 months. We'll be especially ready if every single person on this call gets their flu vaccine. I got mine yesterday, and everybody should get theirs within the next week or two so that they take the burden off of our emergency rooms and allow us to treat those with COVID-19 more efficiently and more effectively because the flu season itself is not so terrible this year. And so I hope that everybody will choose to help us out, to help out the success of our ongoing treatments. I'll close with some of the clinical trials that are going on because I'm sure that people are going to ask questions about this. We're involved with the Pfizer vaccine trial. We had 3,500 volunteers. We've recruited a couple of hundred patients on purpose. We're actually really focusing on getting members of minority communities to participate in the trial. One of the major shortcomings of the approval of drugs in the United States of America is that they have frequently left out underserved communities, and therefore we don't have a really good understanding of whether or not the treatments that are being recommended will work in those communities. As we all know, there's differing responses to different drugs based on your individual genetic and environmental exposures. And so making sure that we have a broad-based participation is critical, and we've been singled out, I'm proud to say, as being one of the most successful sites to recruit minority candidates. And the reason that that's important is that if we just hand out, especially a vaccine that may not have as broad a testing profile as we would like, we want to make sure that we're not missing a complication or a failure to be effective in a subpopulation. And so this is a really critical part of our contribution as a public university, not only just doing the research, but making sure equity in research is achieved as well. I'll stop there and thank you all for listening.
So thanks so much.